Hello, and welcome to the 2021 Open Enrollment Legislator Presentation. My name is Melanie Denning from the Healthcare and Benefits Division at Department of Administration. The purpose of today's webinar is to educate you regarding the 2021 Open Enrollment period and the state plan changes that will be implemented on January 1st, 2021. This information is provided so that you're prepared to complete your open enrollment elections by the deadline and understand details for the 2021 plan year. Let's get started. If you have any questions after this recorded presentation, feel free to contact HCBD either by calling us at 800-287-8266, or you can email us at benefitsquestions@mt.gov. This recorded presentation is available on the HCBD website, and as an alternative, you can also attend a live webinar on October 19th at 10 a.m. This recorded presentation is available at benefits.mt.gov/enrollment. Your open enrollment booklets will also be mailed to you in mid-October. Legislators must complete their open enrollment elections by November 7th, and you may do so online. Legislators will also be mailed a paper enrollment form, which can be completed in lieu of the online enrollment. Either the online election or the paper form election needs to be completed if you wish to make changes or wish to avoid the tobacco surcharge, which we will discuss the tobacco surcharge in the coming slides. You do not have to complete both an online election and a paper election. We just ask that you pick the option that works out best for you. Before we get into the state open enrollment plan details, we wanted to give you some reminders regarding the State of Montana Benefit Plan or state plan. The state plan is self-funded and funded by monthly employer, employee, legislator, and retiree contributions. The contributions are held by the state plan and used to pay state plan expenses, the vast majority of which are claims for services incurred by members for medical, prescription, and dental needs. When you balance the income with the expenses, you get our state plan reserve. State plan reserves are needed because we can't control all the variables surrounding operating the state plan. We can control many of our plan costs, but there are some things we don't have direct control over, including the largest income source of which is the employer contribution. The employer contribution is set by the legislature every 2 years, and HCBD provides funding recommendations, but has to comply with the funding set by the legislature. The employer contribution hasn't changed in 4 years and is not planned to change in 2021. Federal mandates also directly impact state plan expenses. For example, in 2018, the state plan was required to cover statins. These are cholesterol-lowering medications at a $0 copay due to the Affordable Care Act. In addition, due to recent changes to mental health parity regulations, state plan has enhanced some of the coverages available for behavioral health and addiction treatment services. HCBD works hard to estimate and evaluate expenses so that we have a general idea of the volume of claims each year, but there can be surprises. Medical trend, the increasing cost of medical care are all huge variables that the state has little control over, and it can be difficult to predict. The cost of medical procedures and prescription medications continue to rise year after year. The state plan always needs to have enough money in reserves to cover all 30,000 plus members when they need us. The state of Montana continues to implement innovative solutions to address the ever-rising cost of healthcare. Solutions such as reference-based pricing, partnerships with best-in-class vendors such as Navitas Healthcare Solutions, and the implementation of new value-based programs such as medication therapy management and the remote blood pressure management program. These ensure that the state can continually maintain state plan benefits and contributions. Our strategies have been successful in allowing the state plan to control costs effectively and manage the plan and improve health outcomes for you, our members. Healthcare and Benefits will continue the efforts to control costs and manage the state plan and continue to work with Montana hospitals and other partners to address the rising costs of health care on behalf of all state plan members and the taxpayers of Montana. As a result of HCBD's efforts, we're excited to announce that the employee contributions will not increase for 2021. And this also applies to retirees and the legislators. The employer contribution, again, will remain the same for 2021. And this is the 5th year for employees and legislators that there has been no contribution increase. Good news. This next slide reflects the medical, dental, and vision hardware rates for 2021. And again, there are no changes in the rates for 2021. This slide reflects legislator life insurance rates. Again, no change. In addition to no contribution increases, there will also be no change to the medical plan out-of-pocket costs. This means that medical plan copays, deductibles, and maximum out-of-pocket costs will stay the same for 2021. You can refer to the open enrollment booklet, the HCBD website, or the WRAP plan document for additional state plan coverage information. Don't forget, you can get a 3-month supply of your maintenance medications at your local retail pharmacy or through a mail order pharmacy. Maintenance medications are medications that are used to treat chronic long-term conditions. For example, diabetes, high blood pressure, asthma, etc. Remember, Schedule 2 or Schedule 3 prescription medications, which are narcotics, are limited to a 34-day supply. So to get started, just request your prescriber to write the prescription for 90-day supply. You then receive a 90-day or 3-month supply, and you only pay 2 copayments. Most participating in-network pharmacies can dispense a 90-day supply, and you may also get a 90-day supply through our state plan mail order vendors who are Costco, and you don't have to be a Costco member, MyRx Pharmacy, or Ridgeway Mail Order Pharmacy. If a legislator opts out or waives the state plan coverage, then the legislator is eligible to receive the reimbursement up to $1,054 per month for the premiums paid by the legislator in conjunction with the employer group health plan or premiums paid for certain types of disability and life insurance. The state plan is restricted by federal regulations from providing reimbursement for Medicare, Medicare Supplement, Medicare Advantage, individual coverages that are through an insurance carrier, or health insurance marketplace premiums. So to opt out or waive state plan coverage and receive the Option 2 reimbursement, please complete the legislator opt-out waiver form found on our website at www.benefits.mt.gov/forms. Reimbursement of any kind is not available if the legislator has enrolled in the state plan. This year, effective January 1st, 2021, the state plan is implementing a tobacco surcharge for the plan members who use nicotine. This surcharge will add $30 to the monthly contribution amount for those employees or legislators who use nicotine, and an additional $30 a month if the employees or legislators' covered spouse or domestic partner uses nicotine. The tobacco surcharge is a separate surcharge, and it is not the same as the Live Life Well incentive. In order to earn the Live Life Well incentive, remember, plan members must follow the instructions found on the benefits.mt.gov/incentive website and still self-report the nicotine use and status at www.myactivehealth.com/SOM. This important change means that in order to avoid having an additional unexpected monthly cost added in 2021, you must complete your open enrollment elections this year. When completing this year's open enrollment elections, you'll be required to indicate if you are nicotine-free or a nicotine user. Definitions of nicotine-free are shown on this slide, as well as nicotine, which is nicotine being an addictive stimulant proven to have negative health effects that are found in cigarettes, cigars, chewing tobacco, and most vaping products. You are nicotine-free if you have never used nicotine, you've quit using nicotine, or you infrequently use nicotine less than 4 times a month. You are nicotine free if you currently are using nicotine but have completed an eligible offered alternative, such as a nicotine cessation program or had a nicotine counseling session with a medical provider during the last 12 months. The definition of a nicotine user is a person who would be a nicotine user if you're currently using nicotine and have not completed an eligible program alternative. Those alternatives, again, are nicotine cessation program completion or nicotine counseling session with a medical provider in the last 12 months. So during open enrollment election process, you will need to indicate yours and, if applicable, your covered spouse or domestic partner's nicotine status, because if you fail to complete your open enrollment election, it will result in you and, if applicable, your covered spouse or domestic partner automatically being charged that surcharge. So action is required this year. This slide shows the online tobacco surcharge question. It is asked during your online open enrollment elections, but it is also included on the printed election form. Again, it's imperative that you complete open enrollment this year for 2021, or you're automatically going to be charged that tobacco surcharge for yourself and, if applicable, your covered spouse or domestic partner. So during open enrollment elections, you go in and you either elect yes, you're a nicotine user and be charged the $30 surcharge, or no, you are not a nicotine user and the tobacco surcharge is waived. If you have a spouse or domestic partner covered on your plan, you will be prompted to answer the very same questions for them. If you answer yes, there will be a $30 monthly tobacco surcharge on your spouse or domestic partner. So the legislator contributions are outlined in the Legislator Open Enrollment booklet. The booklets are going to be mailed mid-October. The booklets and this presentation are posted to the HCBD website at benefits.mt.gov/open enrollment. Here on the website, you may also locate the 2021 legislator rates by clicking on the Resources drop-down menu, then clicking on Rates and 2021. There is also more information regarding the tobacco surcharge that can be found in the same drop-down menu on the HCBD website under Resources. Just click on Tobacco Surcharge. Again, this year we're providing members with this reminder. State plan members cannot use the state plan, including the Montana Health Center, for any work-related injury or illness. If you or anyone covered on the state plan, including dependents, gets hurt or sick while working, the state plan will not provide coverage even if you have a work comp waiver. As a state of Montana employee, you're automatically covered by workers' compensation insurance. Let's look at this example. If you or a covered dependent own a small business or a working farm or ranch that earns a profit and you're injured while working, you may not submit claims to the state plan and cannot use the Montana Health Centers to treat the injury. Please make sure you and your covered dependents have proper insurance coverage in place to cover work-related injuries. Let's talk about the 2020 Live Life Well incentive. Don't forget, the 2020 Live Life Well incentive deadline is October 31st, 2020. Don't miss out. Completing all required Live Life Well activities is needed, as well as completing all self-reporting requirements to allow you to receive the Live Life Well incentive in your 2021 contributions. Hopefully, you've already had a state-sponsored health screening because we've sent many reminders. And remember, you have to complete all 3 requirements to earn any of the incentive. Although we've added extra screening opportunities at the Montana Health Center locations in October, we can't guarantee you'll get in if you've waited. Incentives earned in 2020 will be applied to the 2021 state plan year contributions. Visit the HCBD website, benefits.mt.gov/incentive for complete instructions and more details regarding the incentive. Participation in a state-sponsored health screening will automatically be reported on the MyActive Health website, but it does take about a month from the date of your screening to show up on that site. Then, to earn the incentive, you must self-report your nicotine status or alternate activity and the next step activity in the MyActive Health website. Even if you completed a wellness challenge like the Governor's Stay Active Challenge, it's not automatically reported, and you still need to report that you completed that next step activity in the My Active Health website in order to earn your incentive. Additional instructions are available on our website at benefits.mt.gov/incentive. Now, if you're ready to self-report, then go to the myactivehealth.com/SOM website. But we do recommend that you review the information on our website, benefits.mt.gov/incentive, before you go in to self-report. Remember, self-reporting your nicotine use status and your next step activity in the My Active Health Plan is not the same as completing your open enrollment election, where you also need to provide your nicotine use status for the tobacco surcharge. Two separate events. Looking ahead to 2021's Live Life Well incentive. The 2021 Live Life Well incentive program will begin November 1st. And we want to make sure everyone's aware that for 2021, the third component of the Live Life Well incentive is going to change. So pay close attention to this next slide. Instead of completing a next step activity next year, instead you will complete and self-report a provider visit that has been completed between November 1st, 2020 and October 31st of 2021. What is an eligible provider visit? It's an annual examination with your medical provider, which is an appointment where your doctor gives you a complete physical examination based on your age, gender, and other factors. This examination should include a discussion of your health screening results. So after your health screening, bring the results to your doctor and review those results with you during the appointment. And if you have medications that you take every day, your doctor may renew those prescriptions at this appointment. Remember, you can choose a medical doctor that best fits your medical needs. Any kind of medical doctor is acceptable, from a family practitioner to a specialist. It just depends on who is most appropriate for you. Please keep in mind that regular benefits apply to this visit, and any additional services beyond the provider's time may incur extra expense. If you attend a provider visit at the Montana Health Center, the out-of-pocket costs do not apply to the services provided. Many of the next step activities we currently offer will continue to be offered. However, next year they will just not be eligible for activities in order to earn the incentive. If there's a reason why you can't do any of the Live Life Well incentive program components, there are exceptions and alternatives available. And this relates both to the 2020 program and the 2021 Live Life Well. Please contact HCBD to learn more. Here's a quick list of the Live Life Well contacts for the incentive program. My Active Health, where you self-report your nicotine status, and this year your next step activity, next year your provider visit. Then the Montana Health Center, where you have your health screening. And last, Healthcare and Benefits Wellness contact information. This year's open enrollment period runs from October 25th to November 7th. You will have from October 25th to November 7th to make benefit elections for the 2021 plan year. And you can do so at benefits.mt.gov by selecting Click Here to start open enrollment. This Click Here to start open enrollment button will not appear on the website until the open enrollment system is available. Remember, it's imperative that you complete either an online election or you complete an open enrollment paper election. You must do one or the other if you wish to avoid the tobacco surcharge. Online and paper elections must be completed, returned, or postmarked by November 7th. Please contact HCBD if you have any questions completing your enrollment elections. During the open enrollment period, you can make changes to coverage like enrolling or waiving the state plan. You can add or change life insurance elections. You can also add or delete dependents from the plan. However, if you want the Vision hardware plan, you must complete open enrollment. And in addition, you must complete open enrollment election if you wish to avoid the tobacco surcharge. If you do not complete your open enrollment election, you will have the same medical, dental, and basic life insurance coverage that you currently have in 2020 for the entire 2021 plan year, unless you qualify for a special enrollment period at a later date. If you do nothing, you will automatically be charged the tobacco surcharge for yourself and a covered spouse or domestic partner if applicable. Additionally, enrollment in the Vision Hardware Plan will terminate January 1st, 2021. The open enrollment period is also a time that legislators and employees can elect to be joint core. If you and your spouse or domestic partner both work for the state, you're eligible for benefits and have a dependent child or children covered on the state plan, then you should be joint core. Being joint core means that you have one shared family max out of pocket, and the rate is better than being employee and children and employee only. For more information, contact HCBD. To begin open enrollment, all you need to do to access the HCBD website is go to www.benefits.mt.gov, and you will then select the red button entitled Click Here to Start Open Enrollment. Remember, the red button doesn't show up until open enrollment begins. If you're a first-time user, click on Register, and you can set up a username and password and answer some security questions. Our company key is State of Montana, and it will already be filled in for you. It's case sensitive, lowercase, no spaces. If you've already registered but you forgot your username or password, just click on Forgot Your Username and Password for assistance. Remember, you must complete open enrollment by November 7th, and the system will show you the number of days remaining to do this. Once logged in, you will need to read several important reminders before starting your enrollment, and we ask you to please take time to read them. So once you're logged in, click on Start Here and follow the instructions that you're given to complete the enrollment. And completing the enrollment by November 7th, the system will show you the number of days remaining to complete the enrollment. Remember, once you're logged in, we'll need to have you read several important reminders before even starting your enrollment, so take time to read through them. To start with, you'll be taken to an About You page. On that page, you must verify your information. So take a moment to review it all on the page and assure it's correct. And if you do have changes, other than your marital status, you will need to contact the Legislative Branch Human Resources Specialist at 406-444-3201 to make any changes to your personal information. If the information's correct, click Next, and you'll be asked to review your dependents for accuracy. At that time, you may add a dependent if applicable. Please remember, if you add spouse life, the spouse must be added in the dependent screens, even though you may not be adding your spouse to the state medical benefits in order to include them as a beneficiary in your life insurance. As you complete elections, a running total can be seen at the top of the page. It reflects a total cost on a biweekly basis. There will be a summary at the end where you'll be able to see a complete breakdown of the total biweekly cost. You will navigate through each benefit beginning with medical. And as a reminder, at the top of each page, there's an important blue box of information about the benefits you're about to elect. Please read the information. When you elect medical coverage, you will be prompted to elect your vision benefit. The vision election will either be basic vision or the vision hardware plan. And once one of the two options is chosen, then you'll be allowed to continue, but you must make a choice. The example on the slide shows medical plan with basic vision selected. Next, you must indicate your nicotine use, and we ask that you please read the instructions on this page carefully. You must either select yes, you are a nicotine user, or no, you are not a nicotine user for yourself, and if applicable, your covered spouse or domestic partner. If nothing is selected, you will not be able to move past this screen. It is important to note that if you're a nicotine user and have completed an eligible alternative, you are allowed to select no. Please refer to benefits.mt.gov/tobacco surcharge for more information on the tobacco surcharge and the eligible exceptions. This shows the employee and spouse's medical election summary including basic vision. In addition, both are nicotine users. So the tobacco surcharge for each one is listed. Now remember, this is a biweekly amount. So the total on this example for employee and spouse is $30 biweekly and $60 a month. This slide shows the biweekly amount. When you reach the vision benefit, remember the vision election was already made back in the medical section. So if changes are needed for this election, you have to click the back arrow and go back to the medical section to make the change in the election. If you elected the medical plan with vision hardware, then the premium is going to be listed on the next screen in the vision section. You may review it there. You should continue through each benefit offered, including dental and life insurance. Each benefit offering has the important information at the top of each page we need you to pay close attention to. So make sure you read that detail before completing each benefit. Then you can review each of your elections and the associated costs before you approve the final benefit election. It's really important when you get to this page that you scroll down the entire page to review each of the elections. If you identify changes are needed, then you can click the edit button right next to the benefit, and then you'll be prompted to review and modify the enrollment. This page will also contain the tobacco surcharge and the Live Life Well incentive if you've earned it. So at the bottom of the review page, you will see your cost. And remember, it's a bi-weekly cost for the elected benefit. If you're satisfied with your election, then you can click on the Approve button. If at any time changes are needed to be made to your election after you click on Approve, then you can do that up till open enrollment closes on November 7th. If you happen to add dependents, you will be prompted to provide the documentation that shows that dependent meets all the eligibility requirements of the state plan. This page shows you which documentation is required for each type of dependent. You can submit the documentation right at this point by clicking on Upload Now, or you can scan and email it, mail it postal mail, or you can fax it in. The dependent verification documentation must be received by December 30th, 2020, so that the dependent will be added to your plan effective January 1st, 2021. Once you agree, you will be taken to the confirmation page, and there you can print a copy of your elections by clicking on the Benefits Summary button at the top right corner of the screen. We encourage you to print or save a copy. Then, if you happen to have applied for life insurance coverage and it requires evidence of insurability or EOI, then you may click on the highlighted box to begin that process. But please note that you're going to have to provide a group policy number, and that is provided for you right above the EOI submission. You also have the option to download the My Choice mobile app on your mobile device or tablet. There too, you may complete your open enrollment elections. The app is easy to download, install, and is available for use all year long for any updates and changes you might have. It's a great way to keep your address up to date so you don't miss out on any of the mailings. To begin installing the app, first you must open the HCBD website and click on the second green box, Existing Member Benefit Changes. When you do that, you will open a page that gets into the system. And when you get in there, in the upper right-hand corner, you'll see a box that says Get Access Code. Then you will choose your phone operating system and enter your mobile phone number and the system operation. Then you'll receive a text on your mobile device that has a link to download the app on your phone or tablet. After the app gets downloaded, they're going to request an access code. You'll need to enter that from step 2 of being on the website. Then they will sync up the mobile application on your device with the enrollment system, and you'll be able to complete all your benefit elections using the mobile application. In early December, you will receive notification in the mail from HCBD that it's time to review your benefits for 2021. So watch for the notification, and then you can go online and verify that you have enrolled correctly for 2021. As a side note, after you complete your open enrollment election online, You can also view the 2021 benefit summary by going back to the home page and clicking Review under the To-Do section next to Open Enrollment. During and after open enrollment, other important documents will be coming from HCBD, including the 2021 WRAP Plan document, or WPD, and this outlines everything that's covered on our plan details. You'll also get a summary of benefit coverage, which is a legal document required by the Affordable Care Act. It's just a short summary of our plan. You'll also receive a Medicare Part D creditable coverage letter and a few other legal notices. So if you're looking for more information on your benefits, feel free to contact Healthcare and Benefits Division staff with any questions or concerns at 800-287-8266, or you can send a question to benefitsquestions@mt.gov. Thanks for attending today.